Hello, and thanks for your interest in the Sonoma County CHW framework. This video will introduce you to the framework, which is the result of a collaborative effort to support the community health worker workforce and improve the health of the community they serve in Sonoma County. The framework project was supported by the Centers for Disease Control and Prevention through the CCR 2109 CHW Workforce Development Grant awarded to the Sonoma County Department of Health. We're excited to share how your organization can be part of this impactful project and a champion of CHWs in our region. The framework, developed with the input of local CHWs, employers, and allies, doesn't just define CHW roles. It creates a shared vision of best practices for hiring, supervision, integration, and sustainability of community health workers in Sonoma County. This truly collaborative process ensures the framework meets the real-world needs of both CHWs and the organizations they serve. By signing on, your organization can play a pivotal role in shaping the future of the CHW field and health equity in our community. The framework outlines 9 key components of the employee life cycle of CHWs in both clinical and community-level programs. We'll go over each of these elements in detail in this video. They are the CHW definition, CHW core roles, recruitment practices, building CHW capacity, pay and benefits, billing, program evaluation, supervision structures, and employee support. We start with the definition of CHWs. The American Public Health Association defines a CHW as a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. Sonoma County additionally defines CHWs as trusted community experts that are widely recognized for their role in providing care with cultural humility and building the capacity of the people they are working with as peers. They provide health education and connect community members to resources. Many CHWs are multilingual and multicultural and have a shared lived experience with the communities they serve. CHWs can also be described by their scope of practice, or the 10 core roles of CHWs outlined by the National CHW Council on Core Consensus Standards, formerly the C3 Project. Organizations employing CHWs in both clinical and community settings should draw from as many of these roles as possible when forming job descriptions, and avoid assigning CHWs job tasks outside of this list. Recruiting a CHW is different than recruiting for other roles, especially in clinical settings. When recruiting individuals to fill a CHW job posting, you should prioritize finding someone with a deep connection to community, who exhibits the qualities of a successful CHW, such as commitment, friendliness, compassion, open-mindedness, and dependability. The framework document includes helpful resources like job descriptions, interview questions, and more. Providing sufficient training to new CHWs is critical. We do not suggest a minimum time frame for training, but we encourage CHW employers to partner with local CHW training institutions to provide CHWs at your organization with basic core competency training to ensure their ability to fulfill the 10 core roles mentioned previously. We also encourage employers to provide sufficient experiential and on-the-job training, such as shadowing opportunities. At the time of writing, in summer 2024, the framework recommends an hourly range of $25 to $29 per hour for new CHWs in Sonoma County. CHWs should be provided paid sick and mental health leave and other generous standard benefits in addition to a flexible schedule. If you are paying a CHW as an independent contractor, you should pay them as generously and fairly as possible to account for self-paid benefits and taxes, and to ensure that you follow all state and federal laws. Consider contracting with CHW-led LLCs or cooperatives to provide CHW services. If your organization currently works with CHWs that volunteer, plan to pay them moving forward and prioritize finding sustainable funding for CHW salaries and stipends. CHW services can now be billed through Medi-Cal and Medicare. Reimbursement for CHWs is still emerging in California, and implementation of both Medi-Cal and Medicare billing is complex. If you choose to pursue reimbursement for CHW services as part of a braided and blended funding strategy for CHW positions, the framework document includes resources to consult. We encourage networking with other organizations doing this work, for example through a learning collaborative, for the best results. It's critical that you evaluate the efficacy of CHW programs so you can tell a story of CHW impact and support advocacy for the workforce. The CHW Common Indicators from the CHW Center for Research and Evaluation, or CHW-CRE, is a list of best practice indicators to use in evaluations of CHW programs. We encourage organizations to measure at least 2 in their programs. Choose the ones that are most important to you and your funders. Ideally, CHWs should be supervised by other CHWs. If this is not possible, CHW supervisors in both clinical and community organizations should have the time and bandwidth to invest in supportive supervision. CHWs have unique roles and often face unique challenges. Their supervisors must be able to provide sufficient support. They should also deeply understand the CHW role and values. If a supervisor is new to the CHW field, they should search out CHW supervisor training or other educational resources to help them understand the CHW role and their role as a CHW supervisor. While there are many ways to help CHWs thrive, we include the most important measures in the framework. First, supervisors must be willing to be flexible around the social determinants of health that many CHWs themselves face, and take time to help CHWs process and find support for stressful situations that they encounter. Second, hire at least 2 CHWs at a time. CHWs must have access to peer-to-peer support and team-based solutions. 3. Build formal career ladders that allow CHWs to progress within their profession, either as higher-level CHWs or as managerial program staff. 4. Find ways to provide job stability and sustainable funding for CHW positions. CHWs should not rely solely on grants so that positions do not have end dates. 5. Support CHWs in their leadership. Give CHWs a voice to guide their work and programs, and carve out time for them to participate in local, state, and national workforce and community health initiatives. And finally, work with team members across the organization, especially top leadership, to share understanding of the CHW role and learnings from CHW's knowledge of clients and community. There are many reasons to sign on to the Sonoma County CHW framework. First, it's an opportunity to improve patient outcomes by establishing thriving CHW programs. Second, it aligns your organization with national gold standards in the field. Beyond these benefits, you'll identify growth areas for your CHW programs, connect with a network of peer support, and reduce turnover in CHW positions. Finally, signing on demonstrates your public commitment to supporting CHWs in Sonoma County and advancing health equity. We've created 4 tiers for organizations to sign on: Gold, Silver, and Bronze for employers, and Ally for organizations that don't hire CHWs but do support the framework ideals. Each level reflects a depth of commitment to the framework, ensuring that organizations of all sizes and capacities can participate meaningfully. By signing on, your organization agrees to a pledge that includes incorporating the framework's guidelines into your planning, publicly committing to its values by posting the logo on your website, and offering peer support when possible. You'll also participate in quarterly check-ins through CHW supervisor meetings. These simple yet meaningful steps ensure the framework's principles translate into action. The process of signing on is designed to get you thinking about your program's strengths and areas for growth. First, your organization will complete a self-assessment rubric based on your status across the framework elements. After submitting your scores through our online form, our leadership team will review and assign your sign-on level. This process ensures transparency and fairness while celebrating the progress each organization makes. This framework is the result of dedicated work by a committee of CHWs, employers, and allies from across Sonoma County. If you have questions or you're ready to sign on, don't hesitate to reach out to the leads, Susan Garcia and Rachel Marcus. We're here to support you every step of the way. Thank you for watching and for your commitment to Sonoma County CHWs.